So the whole my beer comment made me think something somebody told me earlier. And by the time this comes out, it won't nearly be as funny as it will be today. But we're recording this right after the attempted assassination of Trump. And so somebody told me today that, in the aftermath of that he was caught on audio, let me get my shoes, let me get my shoes. So somebody said, let me get my shoes is a new hold my beer. It's really funny. Anyway, off topic. But going back to the TRT thing. So if I did TRT, what does that look like? So you have my numbers, and first of all, what does that? How is it administered? Is it a shot? Is it a cream? Is it a pill? Is it all the above? What is it?
So the cost-effective ways to do it are a shot or a cream. The cream we have compounded, they send it directly to your house. The shot we keep in the clinic, we pre-draw it to make sure that there's not any guesswork of, did I drop too much, too little? Not that I don't trust people, but did you abuse it and drop too much on purpose? We always check something called a controlled substance database to make sure that you're not going to the low T clinic down the road and trying to double dip. Not that testosterone, in my opinion, has the same weight as most controlled substances, but there was a Senate committee with President Joe Biden on that years ago, and testosterone did get lumped into the same category as all of these steroids that people just make and bake in their kitchen or import from who knows where overseas. So we do draw everything up to make sure that everything is kosher, that you're not getting it from somewhere else, so that you're not going to have an overdose of testosterone, which I would definitely be able to tell on your follow-up blood work. You give yourself the shot. So you didn't get to meet our assistant Tina, but Tina comes in, she teaches you how to do the first shot, and then dealer's choice. You can either give yourself the shot in front of Tina, make sure that you did it the appropriate way, or Tina can give you the shot. If you opt for the cream has to be applied to the scrotum. It has to be applied twice a day. We live in Tennessee, as you can imagine. Cream on the scrotum, mid-July, awesome feeling. The problem that I have with the cream for most men is we have crazy work hours. And from the time the cream is applied, there is a 3-hour window where no intercourse with a female can occur unless you want your wife sporting the same beard that you have. So you have a crazy late night, you're really feeling frisky, you came back from a long trip in Delaware and you land, you put the cream on, it's 11 o'clock at night, you'd like that little bit of loving, but now I've got to wait until 2 o'clock in the morning, or I don't do the cream, which the whole point of the cream twice a day every day is because your levels are just perfect. Yeah. You have no peaks and no troughs, which are where the side effects come in. They're just perfect. So then people start skipping. I don't want to do the cream tonight because kids had a ball game. We're not getting back until 8 o'clock. If I put the cream on, I'm not going to get any loving until 11 o'clock. I know after 10 o'clock, the wife is lights out. I'm skipping the cream tonight. So the shots are usually the way that I go. After 6 months, and I have determined what dose you are going to be on, because for that first 6 months, even the little bit your testicles are making, they're going to decrease what they're making, and I don't know how much. So as you are raising, you're also going to be getting pulled down a little bit. So when we land at 6 months, that's probably the dose you're going to be on, without fail. Then we could switch to something called a pellet, where I do a minor surgical procedure. I introduce pellets that are compounded with testosterone in them. They can stay in the butt cheek for about 4 months or so. And that way you're only having to get something done once every 4 months instead of having to do a shot twice a week, every week. 99% of my patients use the shots, 0.5% uses the cream, and we're in the 0.00 for men that do the pellets, because men just don't have as much butt fat as women. So the pocket, a lot of times, if you reach back there, you can feel those little pellets, and men don't love that.
Hey there, it's the Real Jason Duncan. Thank you for watching this video. We've got a couple other videos you might be interested in. There's one here and there's one here. But if you are an entrepreneur and you've ever thought about what it's going to be like when you get ready to exit your business, I'm the guy you want to follow. So make sure that you've subscribed to this channel and go check out the link in the description, therealjasonduncan.com. Check out the resources I've got for people just like you, as an entrepreneur who's trying to get his life back, get her life back, get your time and freedom back. If that's what you want as an entrepreneur, if you're being trapped in your business, then I can help you get out of that. So go to therealjasonduncan.com. The link is in the description and check out one of these videos. I'll see you next time.